Hello, hello, welcome. This is Here's to Your Good Health. I have Dr. David Perlmutter with me tonight. I'm very excited. He is such a nice guy.
Or his brother Mark.
Don't pay attention to him. But I got a couple of, before we get into it with Dr. Perlmutter, I got a couple of housekeeping things I need to talk about. One is next week we are going to have a special on a special segment for veterans and health care available to them through the VA. And a lot of it is free. Isn't that awesome? So be sure you watch next week. And then I want to talk to you for just a minute. I'm sure most of you have heard this story. It is a heartbreaking, horrible, horrible story. My daughter-in-law's little cousin, 5 years old, was riding his bike, and he was on the next-door neighbor's yard. Now, this guy, they lived next door to each other for 10 years, so who knows what the heck happened. But the guy got mad and shot little Cannon point blank in his head in front of his sisters. So my daughter-in-law she's very sweet and very compassionate, and she was moved. She just knew she had to do something. So she started a GoFundMe page to help the mom, the parents, to pay for the funeral. You don't expect to pay for a funeral at age 5. And so she earned $5,500 in about 12 hours. She had to shut the thing down. It was going crazy. So then she started funneling, telling people just send donations to the funeral home in his name. So that has been going on. Today, she was on Blaze TV, which is Glenn Beck's TV thing. He's a conservative guy. And he interviewed her. ABC National News has interviewed her. And now she's working with this guy named something Jones. Hang on, I gotta get to it. And Joshua Jones, and he is going to help her organize a bike marathon. And she's hoping it'll be every year, but it's going to be at least this year for more. Just to remember Blake and I mean Cannon, and to just let the people know there are a lot of good people in this
Absolutely.
world. There really are. So anyway, we don't have a date or anything for that yet, but it's going to be Bike on Cannon, Bike Marathon Charity. Joshua Jones and Christina Prezioso are going to be two of the ones that are involved in it. So I just wanted to let you know. Do you have that picture, Lee?
Get it up.
Okay, I'm just going to flash a picture of little Cannon, and then we're going to go right to Dr. Perlmutter. So we're just going to flash that picture up, and I'm done with my housekeeping and my spiel, but I wanted to bring that out because it's such a horrible, horrible story, but there he is. Isn't he a sweet little boy?
Adorable.
Yep. All right, thank you. We're good, Lee. So now we're going to talk to Dr. David Perlmutter. He's been on my show before several years ago, and then I kind of lost track of him, and he's pretty busy. That's for daggone sure. But I want you to know that, I don't recommend anybody if I wouldn't go to him myself. And so I have not been to Dr. Perlmutter because so far, praise God, I don't need you, and I hope I never do, but my husband had his surgery about a week and a half ago. He had a knuckle replacement. And so Bob, I hope, is watching. Maybe he'll call in. But Bob has done great. He was in so much pain that when he laid in bed and he'd roll over, he'd wince with the pain from the knuckle. And since he's had that surgery, he's had the surgical pain, which is not real bad at all, but the knuckle has not hurt him one bit. Isn't that awesome?
That's perfect.
I'm not telling you anything you already don't know, am I?
Well, it's important to understand that, most people can get their pain better orthopedically without surgery. But when surgery is indicated and it's done well, a great outcome is typically expected.
Yes, and we've had a great outcome. My husband has.
Right.
And Dr. Perlmutter is in his surgical gear because he just literally walked out of the OR to come over here for us. So he probably hasn't had supper. So if you hear some growling, it's probably his tummy.
It's probably my stomach.
So how long have you been here in town now?
I think I'm starting my 7th year.
Oh, okay. You've
Yeah.
been here a while then.
I spent my youth practicing in Pennsylvania and moved down here to join Carolina Regional. I strived and looked for a private practice. I did not want to work for hospitals.
Oh, okay.
At least my interpretation of what hospitals were as employers up in Pennsylvania. Here it's different. The hospital system in town here is magnificent. I'd have no trouble working for them. It's just that my mindset at the time was
Right, sure.
never
Well,
again. Right.
You're based on what you know.
Right. Hospital systems there are, are largely competing large groups, and money and profits drove everything. In all honesty, here at Nash and at Vidant, at least Vidant in Tarboro, where I have my experience, where I work as well, it's quality driven. So if I was to be an employee of them, and I have colleagues who are orthopedic surgeons who are employees of the hospital, they get wonderful support. The hospitals are magnificent. Quality is the thing that drives everything. If you make money, fine, but if you don't, was the person perfectly taken care of?
Right.
And when you have that mindset from the hospital administration, it becomes easy to work for
Yes,
them,
that's
because
right.
it's easy to work with them.
That's right.
Right.
Because the
Just
patient,
magnificent.
just like you, your patient is number one.
Absolutely.
When you are in that OR, I know you were all focused on Bob Brazil, nothing else.
Most important person in my life.
That's
then.
exactly right, at that time. And he would have had to face me had something gone wrong. But, so, tell me a little bit about your volunteer. Are you still doing a lot of that volunteering, going to other
Well,
countries?
this year is on hold for COVID
Of course,
reasons,
of
right?
course.
Our goal over the last 20-some years was to start working at a hospital in a developing country. Third world is not a politically correct term anymore.
Excuse me.
No, it's
I know.
low and middle income country is a politically correct term. And so, for the last couple of years, we've been working in Honduras. In fact, interestingly, San Pedro Sula, Honduras, which is where the caravan came from. I was actually operating in San Pedro Sula when the caravan started.
Okay.
And
It's a very poor country, isn't it? Well,
it's a very wealthy country, but it's a very corrupt country, like a lot of countries without disposable income are. So they have enough to get by. People are comfortable, but we, in all honesty, the United States withheld a lot of critical funding that was funding their police departments, and then when that fell flat, the drug cartels take over, and it's run by mafioso type people now. So,
gotcha.
and so the poor people run to the cities, and then when the cities are under a deluge of rain during the rainy season, they have to go someplace because they don't have the dikes and the water management that we have here, and so they have to leave, and they have to leave en masse, otherwise they'll be killed. So when you hear the term caravan, it's really people walking en masse because they'll be killed if they walk in smaller groups.
Oh, okay, so it's a protection thing.
Just like wildebeest go across the
Right.
Serengeti
That's
in groups,
right.
right?
That's right.
Yeah.
There's a lot of protection in groups. So you
There
do
is.
surgeries there,
We do.
all orthopedic, of course.
We focus every place I've gone, and I've gone to a dozen countries. We've always focused on children, but there's always probably 30% of the patients are adults. When it's elective surgery, when it's emergency surgery, like during the Haitian earthquake in 2012, I went 5 times to Haiti. I was there the day after the earthquake hit. You operated on everybody that you could find.
Sure.
And so it was, the majority were adults, actually. But when you go for electively, we really focus on children because you have a greater impact. We have limited resources, they have limited resources, so you make the biggest impact by operating on the kid that needs it the most.
Right, sure.
Which means you really make decisions about children who really need surgery
Yeah,
but
it's
will
a
never get
triage
it.
system.
Right.
Yeah. So do you operate in hospitals? I mean, is the
We
big...
do.
Okay.
We do. In fact, I'm vice president of the American chapter of the International College of Surgeons, and we are, as part of that, member of a group called the G4 Alliance, of which I'm also on their board. The former group has a seat at the World Health Organization, and one of our charter goals is to teach a person how to fish instead of give them fish,
Right,
of course,
right.
right? So,
Yes.
so we have to identify hospitals that have the capability to learn and to execute once we've left. Last time I was there, I donated $20,000 in surgical supplies and textbooks and computers and disposable supplies like specialty sutures that they can't get there to accomplish some goals, and surgical instruments that can only do what I do, but they just don't have them, and power equipment. We took drills and special tools that borrow skin from one part of your body and move it to another for skin grafting, and those are incredibly expensive instruments. But provide them those instruments enables them to continue the work that you teach them how to do.
Right, right.
So the goal is to put ourselves out of business at every one hospital, and we found a teaching hospital in San Pedro Sula, and we've been working with them for 2 years now, and I could see spending the next 5 years there easily.
Really?
Yeah, wonderful doctors, intelligent medical staff,
Sure.
as well trained as anybody here. They're resource poor, so they can't do the things, but incredibly well trained, compassionate. All the pieces of the gears come together perfectly for a good educational program.
You know, it's all about teamwork, isn't it?
It is, and it's all about orchestrating that teamwork.
Yes.
Right.
Yes, and getting pride and personality out of it and just focus on what needs to be done.
Correct.
And you do that. You're a very nice man.
Oh, well, thank you. But it's not just me, it's a large team.
Sure it is.
My office works very hard for it. They enable it. My partners work hard for it by enabling me to spend time away. It's not just a team that goes there, there's a huge
Sure.
team behind.
Sure, that's
So-
right. That's exactly right.
Right.
That is awesome. So maybe, hopefully, probably not this year, you won't be going then,
We're planning on November.
are you?
Yeah, so if American Airlines is flying, I'm going.
Okay.
Yeah,
You'll just take your mask and go.
that's right.
Have mask will travel.
Yeah.
Okay, so what kind of orthopedic birth defects are there?
Oh, my God. Most of the orthopedic birth defects we call failure of formation or failure of separation. The latter is the most common. For example, fingers that are fused together.
Okay.
Interestingly, one of the most moving experiences of my life happened this last time I went to Honduras, which was about 6 months ago. I brought with me a pediatrician who's going to be a surgeon. They're generally trained in Ecuador first, and this was the first child that I've ever operated on overseas. Went and actually brought her to the United States for several surgeries because 20 years ago we couldn't identify a teaching hospital, so I brought this little girl back, and she lived with us for 6 months. Did multiple surgeries on her in Ecuador and at my house when she lived with us. And then she became a doctor and was actually my first assistant.
Oh, wow. What a great story that is.
Isn't that the best?
Yes.
And so now she's treating COVID cases in Ecuador. She has a year of general medicine to donate back to the society, and then she's going to an orthopedic program, and then we're going to try to get her into the University of Miami for her hand fellowship. So she'll be the first hand surgeon in Ecuador.
Wow.
So.
What kind of surgery did she have? All those multiple surgeries? What was her underlying problem?
Well, let me see if I can find some pictures, and maybe your partner can put them up.
Sure. You have to email them to him. But.
Okay.
Or I don't know. He's pretty.
Oh, we'll try. So
we'll do that at the break.
She had all of her fingers fused together, and I lost track with her for probably 10 years. She tracked me down through LinkedIn. Who would have thought? And I don't do social media very well, and so I was on LinkedIn, and a little bit later she tracked me down, and so her name is Alba, A-L-B-A, and so I was ecstatic to hear from Alba, so now I'm really avidly participating in social media to communicate with her. And she sent me pictures of her playing a guitar, her examining people. She literally had 2 mittens for hands. I separated all of her fingers.
Oh, wow.
Right. So she's able to play guitar and things. So it's great successes, obviously. So failure of separation is one, and that was what Alba had suffered from. And then there's a failure of formation. There are children that are born without a thumb, and so we move an index over to make a thumb, or we'll move a toe up to their hand to make a thumb. A club foot is critical to fix in poorly developed countries, or resource poor countries is a better term, because as an adult they won't get a job. So if you can fix a child, a little boy before around 9 months of age, because they start walking about 9 months to 12, you can really make a dramatic impact on his life. So, and then our time is limited and our resources are poor, so it's tough on us to make a decision. Do we fix a 9-year-old with a club foot that's moderate, or do we fix a 16-year-old or a 25-year-old with a severe club foot that can't walk? So those are ethical decisions.
Those are tough decisions.
Right, they're tough decisions, and in my mind, I always pick the 9-month-old, because if I can fix his foot and he can walk normally, I've impacted his whole life.
Right.
Whereas that 26-year-old, it's much more difficult to fix. He's accommodated for it in his life, and they're best served by other means. So. The best means to serve them is to teach their doctors how to fix club feet, and then he can go on their schedule.
Right. Wow.
So
that is awesome.
Yeah.
All right, we're going to take our first break, and he's going to find those pictures, and we'll see if Lee can't get them up. He got little Canon up for me, so I bet he can get Dr. Perlmutter's up too. So we will be right back with more of Here's to Your Good Health, and we're live, and the number is 407-1111, and Dr. Perlmutter will answer any question that you happen to have regarding orthopedics anyway.
I will.
So we'll be right back. Don't go away.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Looking for an affordable option to treat erectile dysfunction? Ward's Specialty Pharmacy now has low-cost tadalafil troche. Compounded tadalafil troches are small lozenges that dissolve between your gum and cheek. Many ED treatments can cost hundreds of dollars. Take advantage of Ward's Specialty Pharmacy's competitive pricing. 10 doses of tadalafil troches are only $80. A prescription from your doctor is required. Call Ward's Specialty Pharmacy today, 252-459-5544.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Howdy, welcome back. Dr. Perlmutter is still scrolling through all of his pictures. He's going to have to get them organized, I think. That's what happens.
Sooner or later, I'm going to have to do
That's what
that.
happens. You take all these pictures, and then you know they're in there, but you can't find them. Anyway, we're going to try get the picture up of the young lady that he was talking about in just a minute. So, I don't know if I can.
I just need an email address.
Okay, hang on, y'all. It's
Pass it to me while you talk. and I'll get
Okay,
it.
I'll keep talking. So Dr. Perlmutter he works at Carolina Regional Orthopedics, and they have a physical therapy in that office, because physical therapy is really important after you have any kind of orthopedic surgery. And lots of times, back pains and shoulder pains and things like that, physical therapy will take care of it, and you don't have to go under the knife with Dr. Perlmutter, which is very nice. They also have a pain clinic there, because you know pain is a real thing, and a lot of people have pain, and it's not alleviated by natural ways such as physical therapy. So they have a pain specialist there, and he's going to be coming on our show at some point, and we'll talk to him,
He's amazing.
because that is a whole specialty all unto itself, is pain management, and he does that. So I've sent several people there. I'm sure he's got a full schedule. There's lots of that going on. Okay, Lee, he sent it to you.
You got it, Lee.
So, so tell us, you were telling me about the young boy that you did, is that who you just did, the one that cut the tendons?
Oh, tonight, yeah.
Mm-hmm.
So tonight I had my last patient, which is why I'm dressed inappropriately for the show, is a fellow who, my recall is that he's home helping dad who runs a window business, a very reputable window business, but unfortunately the window pane was wet, and his glove slipped, and it went through the glove, a big sheet of glass, and cut his flexor tendon. So flexor tendons are the tendons that help you make a fist. And so he couldn't bend his last 2 fingers at all, and so we have to expose the tendons and sew them together, and then a much longer, much more important therapy process takes place.
Do they normally go back for the most part? I mean, they'll heal and
Right.
you'll use them again? You have some limitations, I'm sure.
Sometimes I've had 2 tendons repaired, and I have no dysfunction, but yeah, it's possible that you have some limitations in motion.
Sure.
It depends on it's more of it's more adversely affected by 2 issues. If it's a really horrible trauma, for example, the glass cut you several times, or if it's a crushing injury, those type of things are tough to get a normal outcome out of. But the thing that affects the outcome more than anything is compliance, patient compliance. And that doesn't mean that they're always being a bad person. Sometimes people just can't deal with pain. I myself am the biggest wimp I've ever met. But some people can't deal with pain. Some people can't afford their pain medicine. Some people can't afford the therapy, and that adversely it creates an outcome. You know, so I look at it, and what I tell patients is, you do 30% of the work, I do 30% of the work, and the therapist or your therapy cooperation does 30% of the work. If I do a great job, and the therapist does a great job, and you don't, whether it's something that's your fault because you're a slug and you don't participate in the process, or it is because you can't afford the therapy or something that's, understandable, then your outcome is much less. If I do give you my 33% and you give me your 33%, but the therapist doesn't do their job,
Right.
then that's a 66, and that's a failure in every grade book, right?
That's right, that's
so
right.
all of us have to meet and satisfy our 1/3 requirement for a great outcome to occur. And unfortunately, that's not always doable, and it's nobody's fault, but it's not always
Right.
achievable. So you work around it.
Is therapy pretty much like it for insurance? Because I know a lot of people don't go to physical therapy because they have such a high copay.
Right.
But when you've had a surgical procedure, is the insurance company a little bit more lenient?
No.
No.
Insurance companies, I think, are the bane of our medical existence.
Yes. Yeah, I'm with you.
I believe that they exist for profit only.
Yes, they do.
We have had in our office $5,000 copays for us. We've got it down by jockeying insurance companies, but when you have to pay $3,500 or $5,000 out of your pocket, particularly at times like this when people are struggling, it's almost impossible. People hear a lot about I'm glad we don't have a Canadian insurance because I don't want to have to wait a year for my knee replacement.
Yeah, well.
I have patients who never have a knee replacement because they can't afford the 20% that Medicare doesn't pay for.
Right.
A Canadian may have to wait a year, but
they're
100%
gonna get it.
but they're going to get it, and 100% is paid for.
Yeah.
And it's
Yeah.
not driving you to the poorhouse to get it.
Yeah.
So, and it's not just with knee replacements, it's with a lot of things that we do.
Sure.
Like your husband's knuckle replacement. Before I could do that, I had to try therapy. If you
Oh, yeah.
and if they didn't pay for therapy, it's $70 an hour out of your pocket, or $70 a session out of your pocket. Not too many people could afford that. They have to have a prescription anti-inflammatory, not an over-the-counter one. It has to be a prescription one, right? They're not cheap,
Right.
I have to inject it with steroids. If you're diabetic, that gives you risks, right? And it's contraindicated in most arthritises anyway, particularly in the hand. So the insurance company makes us do this spin
Yes.
under the pretense of saving money, but they're really delaying care.
Right.
So, and if there's an insurance person out there that would like to argue with me about this
Call
in
us.
this venue, please sit next to me. I'd be happy to talk to you, because you're not on my end of it.
That's right.
And so we functionally deny health care in our country by
Yes.
making copays so absurdly high that the insurance companies laugh all the way to the bank.
That's right.
I tell my patients, go to any town and tell me what the tallest building is.
It's an
That is-
insurance.
It's an insurance company or a bank.
Yep.
And insurance companies are banks.
Yep, you're right.
What do you think they do with your money?
Well, yeah.
Okay.
Well, I was hoping that was maybe kind of like written in the surgery procedure or something, because it makes me so mad, because people can benefit from physical therapy. They can get that, they don't have to take pain medicine, they can get back to where they need to be.
Absolutely.
But-
and there are some insurance vehicles like Medicaid that will pay for 2 therapy sessions.
I know.
I mean, we have my hand therapists at Nash are amazing. They're as good as I've worked with anywhere in the world, and better than most. As are the people at Select and other places in town. There's wonderful therapists all around town in modern physical therapy. There's absolutely amazing therapists. The truth of it is, if you can't get to them and if you can't afford them, you may be driving yourself to the operating room when you otherwise could have gotten better without surgery.
Right. It absolutely drives me crazy, because then, and the insurance companies also limit you on how many, for instance, a strong narcotic pain pill, which some people need after surgery, you're limited in that.
I'm not totally against that. I think physicians are largely responsible for a lot of the drug addiction problem in the United
Yes,
States.
I agree with that, and I understand that, but sometimes you just need some.
Right. There's an appropriate use of narcotics, and there's a clear and inappropriate use of narcotics, but to not allow therapy to beat that dead horse, and there are multiple pain-lowering modalities.
Right.
While you're limiting pain medicine makes no sense.
That's right.
Right? If you're going to limit pain-limiting modalities, then make them available by other measures.
Right.
Right.
Because I know that the VA is, they've really looked at this, and they are authorizing more physical therapy, more chiropractic care.
As they should.
And because they're realizing that throwing all those opiates at these guys and gals is not doing anything but
Correct.
making them addicts. You ready for the photo? Yeah. Okay, go ahead. We're going to see the photo, and Dr. Perlmutter can tell you what all these things are.
All right. I just have 4 photos, I think. I'm not
Okay.
sure what order they're going to show up in.
Well, we'll get to it. Go ahead, Lee. Okay, what's this?
Okay, so this is a fellow, you're actually looking at him 2 days after his surgery. Excuse my cough. That's his big toe.
Oh, he didn't have a thumb.
He did not have a thumb. And he refused to let the cartel know where his grandkids were. And so they have a penchant for cutting off part of your right hand. The first time, the second time they have a penchant for killing you.
Oh, good
So,
grief.
and so he's a baker, and so he needed to support his family.
So are
I'm so
those
sorry.
pins sticking out? They're like
Those are-
stabilizers?
Those are pins. In the United States, we would still use pins similar to that, a little bit different form, but those are pins holding his toe onto the base of his thumb.
Okay.
So we remove the toe, reattach the nerves and the arteries into the hand, and it lived. He has a functioning thumb.
Wow, that's amazing. Okay, Lee, we'll go to the next one.
So we talked about birth defects. This is a little girl that was born with 2 thumbs. And so that's highly dysfunctional. There's one metacarpal bone, which is the bone immediately at the end of your forearm. And from that, in a Y-shaped pattern, is the metacarpal bone. And then there's 2 normal distal bones at the end of those. So the job here is to eliminate one of the thumbs and centralize the other thumb on the end so that it grows normally. And doesn't flop off to the side or anything like that. So it's more art than medicine. That you really have to work with carving. It's highly a carving job and ligament reconstruction and nerve repair. These are a boatload of work. It's a 4-hour surgery.
Oh, yeah.
Done well, and it's a 4-hour surgery in that environment. It's an hour and a half, at Nash Hospital.
Gotcha.
So, the outcomes are amazing. The
Wow.
fact that you could take the dominant right hand of a little girl and give her a normal looking hand with some very hidden scar tissue is terrific.
Right. Those instruments must be so fine. I mean,
They are.
Nerves are like, there's itty bitty, teeny weeny,
They are.
as are the arteries.
Yep.
And that size thumb.
Yep.
Wow.
That by way of comparison, that's my thumb
Right.
in the photograph,
Right.
and
So she's
in my
really
hand.
little.
Yeah, but that's the time you have to get to them. The earlier you can get to them. I've operated on them much younger than her.
Oh, wow.
And the younger that you can get to them, the better it is. So that's a win. Just to continue the discussion in a different vein, this little girl. In many countries, I don't think it's so much true for Honduras, but in many countries, particularly the rural parts of Ecuador, they would never get married with a hand like this.
Oh, really?
No, they would never get married. A boy would never get married with a clubfoot.
Are they considered like it's a demon or it's a evil spirit or?
Probably more of the latter. They're almost predominantly Roman Catholic countries, but that there's a word for it, but when I asked for it to be translated, they told me our translator said voodoo, but it's not real. It doesn't translate exactly into that. There's ancient religious thoughts still pervade,
Right.
and but kids with birth defects tend not to get married, and their social life gets destroyed.
How
so,
awful.
So you really don't just give them a hand back.
Yeah,
you give them
a
a
whole
life
life.
back. Right.
Yeah. Lee, we're going to stop right here and do our second break, and then we're going to come back and finish up the pictures. So, isn't this fascinating, y'all? I wish we had 2 hours, but Dr. Perlmutter says, oh, no, I got to go home and eat. So we're going to take our second break, and then we'll come back and we'll finish up with the pictures and anything else. And don't forget, if you got a question, 407-1111. All right, we'll be right back. Don't go away.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently. So we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Are you suffering from chronic pain, have aches, migraines, or just general discomfort? Ask Ward Specialty Pharmacy about their new pharmaceutical-grade, full-spectrum hemp extract, commonly called CBD. CBD has no known side effects and is available without a prescription. CBD can potentially help with migraines, anxiety, depression, insomnia, and other discomforts. Ask the knowledgeable staff at Ward Specialty Pharmacy about CBD and start feeling like yourself again. Ward Specialty Pharmacy, 3646 Sunset Avenue, Suite 110 in Rocky Mount.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, we're back. Howdy, howdy. Welcome to Here's to Your Good Health. I'm Linda Prezioso, a nurse practitioner at Family Medical Center, and my guest tonight is Dr. David Perlmutter, who is actually he's an orthopedic surgeon, but he is a hand specialist. Is that right?
That's correct.
That's correct. And so we've got some more pictures out of his phone that we're going to pull up, and he's going to expound on them. So this ought to be very interesting. So go ahead, Lee, pull up the next one for us.
So this is a little boy that did not form any digits. There's no surgery on his index through pinky digits. The fingers just didn't form. And so the first thing before we move toes is we have to create the base of the thumb. Mm-hmm. And so I separated his index metacarpal out and
mm-hmm.
rotated it so that becomes the base of a thumb.
Oh, wow.
And so now he may choose to just keep that and use that as a pincher, mm-hmm. or may choose later to put toes at the end of those two bones so that he has longer digits to pinch against.
Mm-hmm.
So.
Wow. All right, Lee, the next one. That's amazing.
There she is.
There she is.
So we're in Honduras here. It's the first time I've seen her in almost 12 years.
Oh, wow.
12 years, maybe 18 years. And she's a doctor there, and I'm so proud of her.
You should be proud of her. That is just such an awesome story.
Yeah.
And she's still, didn't you say you're going to try to get her into Miami for her hand fellowship?
We are, yeah.
Yep, that's awesome. Okay, Lee. Next. Oh, there she is
So
again.
this is a picture she sent to me after she tracked me down, and I didn't know who it was at first,
mm-hmm.
Because she's playing a guitar.
Yeah.
And then she said, it's me, stupid. So, but last time I saw her, she was 5 years old.
Oh, yeah, a little girl.
Yeah.
Wow. Okay, Lee. Isn't that awesome?
But
And you made those fingers for her.
I did.
Yeah? All right.
That's another picture she sent me. She's playing doctor in Ecuador.
Mm-hmm. She'll be a fabulous physician.
Yeah, she is.
Okay.
So this is an interesting picture. So she's, and I put this up to show the hand on the right. That's the simplest of things that we work on there. And if you can see, the middle finger and the ring finger are fused together. So of all the deformities that we fix there, or even in the United States, that's the simplest. It's just separating two fingers out. It's when all five are fused together that it becomes more complicated, because then the bones fuse together too. But if you look at the hand on the left, that is a hand of Alba that I operated on 18 years earlier. So this is the two hands, my first patient I've operated on overseas, and my last one that I operated on overseas.
That is so cool. So for this one with the two fused, is it their bones are there, everything's there, you just kind of...
In that kid, the bones were there. We saved her as the last patient because we were literally catching the shuttle bus to the airport as I put her dressings on, so we saved simple ones for last. And so there was, in this case, the bones are not attached at all. It's purely skin.
Okay.
And so it's a much easier separation.
Yeah.
If you look at Alba's hand on the left hand of the screen, her index and middle finger were just skin, and so they separated beautifully. But if you look at her pinky and her ring, there was bone that was attached between those. So the scarring is worse.
Right,
the outcome is not as nice because they were sharing bones. And sharing a joint in that case too. So.
But she can play a guitar.
She can play a guitar.
Wow. Okay, Lee, next. Oh, I guess we're done. Well, welcome back. Here we are. So, let's talk a little bit about arthritis.
Okay.
That is such a horribly painful disease, and just
It
about
is.
all of us have it.
Right.
So what are things that you can do for arthritis?
Well, I'll answer that differently. I'll answer it what medicine can do for it.
Okay.
Right. So there's several classes of arthritis. Two general classes: wear and tear arthritis. It's where the bones just grind into each other, and it's typically from a ligament that may have torn, for example, in a knee, and the leg tilts out a little bit more than it should, and it wears out one side more than the other. And that often leads to cartilage tears that we can arthroscopically fix. It often just starts off with just effusions, fluid collections that we can treat with pills or injections, and often that's wonderful. And if they do need surgeries, if you get it early enough, an arthroscopic surgery with two little tiny incisions works wonderfully. If you really ignore it and you need a knee replacement, a modern knee replacement is amazing. At NASH, you go home literally the next day. I've had patients who want to go home that day. But it's not the same as it was when I trained, where they we'd come 2 days before the surgery in the hospital and stay for 2 weeks afterwards.
Oh, Lord have mercy.
My God, right? And but now you're going home the next day in many places that day. The surgery's advanced. It's obviously largely much less painful than it used to be, and people do well with it. So the spectrum is pills, injections, therapy, limited surgery, we call it arthroscopic surgery, or joint replacement surgery. And your husband had a joint replacement. We tried injections, we tried therapy, we tried high-dose medicine creams that often work very well for a hand because the medicines penetrate through the skin fairly well, and right below the skin is the joint in a hand, not so much a hip or a back or a knee. But the knuckles are very close to the skin, so those medicines tend to work better. But at least in my practice, not where I trained, but in my practice, and with the other orthopedic practices in town, I have to say, conservative management really prevails. We all treat people like it's our family, and we're not at all interested in rushing you to an operating room. That's always a treatment of last resort.
Right.
And that's whether it's a wear and tear arthritis or the other class of arthritis is called inflammatory arthritis. And what I mean by an inflammatory arthritis, there's basically two different kinds. There's a kind where, and I'm not talking about infection's another one, but we're not talking about that now. In inflammatory arthritis, you've all heard of rheumatoid arthritis. Well, that's a classic and the most common inflammatory arthritis. There's other types of arthritis in that class that are caused by psoriasis, has a propensity for the distal joints of your finger and the base of your thumb, and then some people can give you little pits in your fingernails. And lupus is another one, but rheumatoid arthritis is really the mainstay. And there's an absolutely amazing rheumatologist in town. He works at the Boyce Willis Clinic. Dr. Chaudhry, if anybody suspects they have rheumatoid arthritis, you just can't do any better in the world than him.
Right.
He's truly an amazing rheumatologist. But often, if you wait too long, a rheumatologist can help you keep the swelling out of your body and the pain. But if you have a dysfunctional joint, you're really looking at a mechanical problem, and mechanical problems have to be fixed mechanically. And so sometimes that mechanical fix is splinting, functional splinting. Often it includes, if not always includes, a smart therapist to partner with. And this town is loaded with smart therapists.
Yeah, we've got a lot of good ones.
And just tremendous. Chiropractic care has a strong role in that. Good chiropractic care, and then surgery has a role. If you have a torn ligament, reconstructing a ligament is not a hard thing to do with modern technology. And joint replacements are, as I just espoused, the biggest joint in our bodies, our knee, and that's an easy joint replacement to do these days. And hip replacements are even less painful. So arthritis runs the gamut. It runs the gamut in severity, whether it's an inflammatory arthritis or a wear and tear arthritis. I would encourage to seek attention first with your family doctor. They're impressively well armed intellectually and with their technical skills to manage early arthritis, and they will refer to us if that's not working. But don't ignore it. Don't live with joint pain. Right. And then, of
There's
course,
too
there's
much
things
we
that
can
you can do on your own.
Sure.
Weight loss does have a role. Smoking is horrible for joints. Smoking is horrible for everything, but it wreaks havoc on joint health. It wreaks havoc on any part of your body that has a limited blood flow. And it's not just always the tar, it's the nicotine that's my biggest enemy. So if somebody says, I'll stop smoking with nicotine patches right after surgery, don't.
That's not going to do it.
Right. Go on Chantix or Wellbutrin or another medicine, or cold turkey, but I beg them not to do patches or nicotine gum. At any rate, non-surgical treatments should be really exploited first. And so losing weight, stop smoking, and then there's a new understanding of herbal medicines, which are healthy. Turmeric has a compound in it that you can even buy from some companies as an isolated compound. But it does help with inflammation. Omega-3s, ginger, cinnamon, they all have garlic. They all have components in it that to some degree or another help with inflammation. And I have patients who swear by them. And I have many patients who say, I'm just wasted their money recommending that they get it. And that just brings up the last point, that there's a high variability in how things work. An injection may work wonderful in somebody, and somebody may have actually less disease, and it may not work at all.
Right.
So it's a very individual thing. But injections in general, nothing works as good as the first one.
Right.
If your first injection works and you hit a home run with it, you could reasonably expect a home run if you did a second injection. Or maybe a triple, but if a triple lasts for 6 months, that's great, right? If it lasts for 6 years, it's better.
Yeah.
So it worked wonderful in your husband for a long time.
Yeah.
Yeah.
But then it didn't.
So, until they don't, right.
All right, it works great until it doesn't. So, just real quick, a bone spur.
Right.
You can have bone spurs anywhere you got a bone.
Right.
But they're really kind of painful, like in the spine and in the neck. And do you ever remove those?
Often. For example, a bone spur can be caused by two things. I'll give the first example with an analogy. If you sand a block of wood with sandpaper and you look at the edge of the block of wood, you'll see sawdust, right? So if you have two bones that are rubbing against each other, it generates cartilage, living cartilage, and living bone dust. And they pool in the outside of the bone, just like the sawdust collects out on the side of the wooden block that you're sanding. The difference is that wood is dead and the bone is living, and then it heals just like fractured bone would heal, and you see it as a bone spur on the edges of joints. And so it's really the living residue of the grind.
Wow.
And when you do a joint replacement, often the joint that you see, like I did 2 knuckle replacements today, actually 1 middle joint and 1 knuckle joint on 2 different people. The cartilage is scraped clean, the bone is shiny because it's polished like you'd polish anything, and off to the sides are huge spurs, which are really the collections of bone dust that have consolidated into a spur. And they're often very painful. But what really is the source of pain is the lack of cartilage, which is the padding at the end of the joint, right? Once you wear that padding away, it's gone. And then in closing, the last form of bone spur is where a ligament, like a heel spur, for example, where the tendon just pulls and pulls and pulls and pulls on the bone, and it micro tears. And as the tendon tries to reattach itself, God's pretty smart. He says, I'm going to heal this with the strongest tissue known. I'm going to turn it to bone. And so when you look at a bone spur on an x-ray, you're really looking at the once tendon attachment to the bone that's now turned into bone to stop you from ripping it. And so it's not the bone spur that hurts, it's the irritated fascia, the plantar fascia that's pulling on that bone spur. It's really plantar fasciitis, not a bone spur, not a heel spur. So there's no such thing as a painful heel spur. It's plantar fasciitis.
Gotcha.
Right.
All right. Well, I could go on and on about that. I love this show because I learn so much every time. But we have got to go. So thank you so much for watching. I appreciate it. Don't forget, next week we're going to have all the VA benefits of insurance, a lot of it free for our vets. So that should be an interesting show and give you a lot of good advice. Y'all have a great evening, and we'll see you next week with more of Here's to Your Good Health. Good night.
Good night.
Awesome.